Coronavirus disease 2019, known as COVID-19, is an infectious disease caused by severe acute respiratory syndrome coronavirus 2. It's a novel virus and it has spread globally, causing the coronavirus pandemic.
Thousands are dying every day, especially in a developed country like United States and Italy. Experts are working hard to develop vaccine and find a cure.
It affects both the young, the old, the rich, the poor, female and male.
It is no more news that coronavirus is here in the country and the number of cases have been increasing on a daily basis. Prevention, they say, is better than cure.
Kudos to all health workers around the world. This is indeed a trying time when we have to combat this coronavirus pandemic.
Just as we, the healthcare workers, are encouraged to look after ourselves, it is also your responsibility to look after yourselves and help us to look after you.
Coronavirus is not written on the face. It does not show on the face. Therefore, some people can be asymptomatic, meaning they would not have any symptoms. However, some people have symptoms. So, these symptoms would include fever, cough, difficulty breathing, stomach pain, diarrhea, sore throats, inability to smell properly or inability to taste properly.
This is a droplet infection, which means it's not airborne like people imagine, but it settles on the floor or other surfaces.
Dear Nigerians, we are all aware of the COVID-19 pandemic being experienced globally. We are at war, and losing this battle to contain the COVID-19 pandemic will lead to deaths and disabilities of unimaginable proportion. Whilst we, the medics on this side, struggle to contain the virus from spreading, we expect you, on your own part, to play the roles assigned to you. First, maintain social distancing. Do not touch any part of your face. Wash your hands and sanitize them regularly. Avoid gatherings. Do not organize gatherings. If you have a history of recent travel, self-isolate. And if you have any symptom that you are worried may be related to the coronavirus, call the designated number.
We need to work with the government by listening to every regulation such as staying at home.
Our senior citizens are particularly at high risk of very serious fatality when they have coronavirus. It is our responsibility to protect them by staying at home.
You may be able to guarantee your own safety regarding this virus, but how about that woman in the marketplace? How about that bus or cab driver? How about that your friend that you pick up every morning on your way to work? How about the people in your church and in your mosque? Can you guarantee their safety? Let's not jeopardize our lives and those of our loved ones.
Since the emergence of COVID-19 pandemic, people have been involved in so many practices which do not prevent or cure coronavirus. Taking hot lemon, drinking alcohol, drinking palm oil, use of special oils cannot kill coronavirus. Eating garlic and ginger cannot eliminate coronavirus. Gargling with warm water and salt definitely does not kill coronavirus. Inhaling steam or concoction certainly cannot help to eliminate coronavirus. Generally, inhaling steam can help relieve symptoms of clogged up upper respiratory airway. Does not mean that it can cure, eliminate or prevent coronavirus. Many of these practices, rather than help the body, cause further damage to the body. Hence, they need to be stopped.
We cannot afford to lose this battle, because if we do, it will be a disaster. Stay at home.